testing. Here we go. So as I say, I'm Jo Evans, I'm the Continuous Improvement Manager, and this session, 45 minutes, is going to be looking at evaluating the impact of COVID on our carers, on our service users and on our staff as well. So just in terms of how this session will run, really, there is quite a lot of information giving, so just going to run through the background to the project, give a very brief example, more really to show you what we're offering to teams in terms of presentation rather than content, for the example of the team analysis report. And then really what I want to spend the most of this time on is looking at some of the key themes that came out. So what were the positives that have come back, but also what are the areas for learning, and how we can look for improvement. Then a little bit of time to link to stakeholder evaluations, and we've got Robin Fletcher on here from Sheffield Flourish, who I think is just going to give us a little bit of an overview from there, and hopefully that'll leave us about 10 minutes at the end to have a bit of a discussion, start a discussion really, that I don't want to finish in this session. I'd like it to continue after the session about how all of this is going to help us improve. So a little bit of background, just to say this project does focus really on the changes to the service delivery. So it hasn't been looking at the mental health impact, that kind of thing. It's been looking at the change to the service delivery. And it looks at it from 3 different perspectives. So first of all, the service users and carers. So what's been the impact on our service users and carers? And we've done this through questionnaires. And we've developed them that are specific to the service. So we've developed a template that we've then taken to each service to try and make them more to own the questionnaires. So in terms of other questions on there actually relevant, we could have done a really quick questionnaire across the whole organisation, but actually there's different services with different needs and different service users. So we've worked with individual teams. We've tried to make the questions service user friendly. So for example, community learning disabilities, obviously their format needed to be quite different, and we've worked with the team on that as well. Just to say, every questionnaire then we did take the opportunity to include the friends and family test at the end as well. So great opportunity to try and promote that a little bit more, and also to care opinion if people wanted to give some wider perspectives on care that they were receiving. They were distributed as well to service users and carers, again, according to how the service is recommended. So they might have gone out via text message, if that's how they communicate, if that's how the team communicates with the service users. It might have gone out via a letter or via email, or some teams actually used phone calls. And there's examples where we've used our volunteers, and they've worked really closely with the teams, the volunteers then being able to support this work as well. So we've really tried to do this in a collaborative approach. In terms of if it was a letter, there was an offer then as to how you want to be able to feedback. So that might be through a link online, it might be through the free post, or it might be through an email. In terms of colleagues, in terms of staff, that was really mainly being sent out via an online email. There were some teams that wanted to then print that out, but majority of those have gone out through email. And then data has been looking at we've been working with different people within the organisation, again within the teams, but also governance officers, the business and performance managers as well, to try and get this data through. So that's a rounded view as to where this information has come from. In terms of numbers and who we've been working with, well, the QI team have offered this support to 37 individual teams. Of those, we're actively working with 22. 14, as it says up here, are at the data analysis stage, with 1 still collecting data, and 7 are still developing surveys. And that might feel, you know, COVID's been around for a little bit now, but actually, as we've said, what we're trying to do is really work with teams for them to own this piece of work. And if it's not right for the teams, if it's not the right time, if they don't feel that it's the right time to be sending questionnaires, either to their staff or service users or for this, we've gone with that. So hopefully that is getting the teams a lot more engaged than if we've just we don't want to force this upon teams. There's 15 teams at the moment who aren't involved, and that might be because they've not responded to our offer. It might be because they're doing their own evaluation, fantastic, or it might be, like I say, they've just declined at the moment to participate. So we will be picking that up again when hopefully things have settled a little bit, because COVID is going to be here for a little bit longer, so it's not like we've missed the opportunity. In terms of numbers there and responses, this is where we're at in terms of those 14 teams which we've got back. It's very difficult to say what kind of response rate this is, because obviously we can't say exactly how many have gone out, but we think that it's around a 15% response rate for service users and probably a little bit higher for staff. So that's where we're at there. So in terms of what the questionnaires we're looking at, the service users, key questions focused on these 5 areas really. So accessing support, how easy it was and did they know how to access and their experience. Were they offered a telephone or virtual appointment in place of the face-to-face? If they were, how helpful was that? And also around, is this something that people would like to see in the future? You know, have they preferred this, or what's been the advantages and maybe disadvantages? In terms of contact, has contact been maintained, consistent, and what's the experience been of that? And then where appropriate, we've been asking around peer support. So are people having access to that where they're used to? And the key question being, has anyone got suggestions around how we can do this in this kind of socially distanced environment that we're living in at the moment? And then I've just written general there. So some teams did want some specific questions, maybe around provision of information. There's lots of other things that might be a bit specific to their team. As I've mentioned, friends and family testing care opinion were included in them all. And then an opportunity at the end of the questionnaire for any suggestions, comments, anything that we might not have given the opportunity for people to say within the questionnaire. And then you'll notice actually in staff, we've got the same headings, so we were looking at the same kind of things, but from the staff perspective. And actually, in terms of accessing support, what support did staff have? What support have staff had through this period? How available has it been? What's been their experience of feeling supported as a member of staff working for this organisation? What's been their perspective of what they're able to offer? How helpful have they felt? What's been the quality that they've felt? And do they want to continue in this way, or what's their preference? In terms of their perspective, do they feel that they've maintained contact? And how's it been with consistency in supporting other members of staff, perhaps if they've been off? How have they found that experience? Is anybody offering peer support? What suggestions, again, from a staff perspective? And then just looking here, again, finally, at some general things there around suggestions and maybe availability of resources, equipment, for example, those who are working face-to-face, having protective equipment or the right IT, etc. And this is where talking of IT, if we can move the slide on. There we go. Okay. So I'm not going to talk through this, as I say, in great detail, but I just wanted to show really the work that the QI team have been doing. This is an example from South Recovery, and it is only part of the report. In terms of what we're presenting back to teams. So starting with some numbers in terms of response rates. I don't expect you to be reading any of this, by the way. This is just to show people in terms of the kind of thing we're presenting. So an overview of what service users are saying, what's the summary of findings, and what are some of the key themes for improvement. And then breaking that down a bit then for those who are a bit more interested and want more of the detail, because there's been some really rich information come through. So through ease of access in terms of putting graphs in there, but also there's some really rich information come through for the words. So I don't really make it, again, any apology that there is a lot of information, a lot of words, and we've tried to put that in split it so that we can see positives, opportunities to learn. Again, other examples here of graphical data, positive comments, opportunities to learn, and maybe some kind of constructive comments around helping. For this one, for example, is about why people preferred face-to-face for here. Again, friends and family, we've done an overview and just a different way really of pulling all of that information together to highlight some of the things that came out positive and the opportunities to learn. Again, the bigger the words, the more times that is mentioned within the work that we've done. And again, other comments. And then we've just done a similar thing for colleagues, again, a summary slide, the graphical data and the comments. And I think we just felt it was really important to give all of this information back to teams. And it is detailed, it's summarised, but if you want the detail, it's there. And then finally, the data. So pulling out what's the key data. So actually, the calls versus face-to-face, this might be quite obvious that some of those have gone up. But what's happened to referrals? What's happened to discharges? How has COVID and the changes in service impacted on that? What's been the impact on things? So, for example, here, care plans with the compliance, etc. What's happened? Has there been an impact there? Risk assessments, and also staff sickness rates. Really interesting on this particular one. So trying to pull all of it together to look at a really rounded approach as to what's been happening over the last few months. And then pulling all of that together, and again, these next 2 slides are probably, or 3 slides are probably the key ones for the teams, really. So if you don't want to look in all of that information, the detail, we've spent some time actually triangulating, pulling out themes. What's all of that from the staff, the service users, the data telling us? What are the key themes? So for this example, there's been 10 key themes that's been pulled out. And then finally, we're presenting the teams with this. And the idea of this is to say, yes, we can work with you as a QI team, but this is for the team to own. We've collated all this information, evaluated it, and a bit of that so what question really. What are we going to do with all of this? What are you as a team going to do, and how can we as a QI team support you? So what are some of we've given some prompts here around what are some of the things that from that feedback that we want to do? Who's going to lead on that? When's that going to happen by, and how are we going to show that some improvements have been made? Or maybe the improvements haven't been made, but therefore we've got some measures, and how can we learn from that? One example with the South Recovery team is that they have sent a letter out to every service user that they invited to be involved, and done a little bit of a "you said, we did" from this exercise. So we really want to encourage that as well. So whistle-stop tour of that kind of presentation, but what I'm wanting to just look at now really are some of the key themes that have come out across those 14 teams. And I have to say, like I said, we are still analysing some of them. There's an awful lot of data. So this is initial kind of themes that are coming out across. I'm not going to focus on Attend Anywhere. For those of you who know what Attend Anywhere is, so the virtual platform that we've got for face-to-face appointments. There is a separate session on that this afternoon at 3:30. So if you haven't registered, if you are wanting to do that, if you go onto the website, you can get a link to just join this afternoon. So the first theme, looking at telephone virtual versus face-to-face. What were some of the things that came out there? Again, there's lots of words on here, and it's quite difficult when we've got so much information, and also wanting to make this available for people who aren't on this here now, so and be able to take this away. So just for me to talk through some of these, you cannot clearly read these. So some of the positives, most service users were really grateful in terms of there was something. We haven't just cancelled everything. There is a telephone, there are virtual appointments being offered, and the majority of people found those helpful under the circumstances. Some people did find it easier access as well. There were comments around actually they normally have to go across town. Well, it's a reduction in travel, so they found it easier. And again, from a staff perspective, actually, all that reduction in travel time gave extra time to be able to do things like mandatory training, assessments, reviews, which again is what the data was showing as well. So that's where bringing all three together has been really helpful. Particularly helpful follow-up appointments, that was the feeling, not so much for people who were new, and we'll go on to that in terms of opportunities to learn, but for people already in the system, a really helpful way to keep checking in. In terms of reducing DNAs, so do not attends or wasted visits, we found that a lot of teams found that there was a reduction. I think what seemed to be coming through, the people who have done this, the teams that have done this a little bit later, are finding that they're actually going back up again. So we need to have a little look into that as to why that might be, but actually that generally there has been a reduction in those. More flexibility with the appointment times, and also some services, so eating disorders, for example, we're talking about actually it helped them be a little bit more organised in terms of sending information out. So key things around opportunities to learn. Overwhelmingly, there was a preference to return to face-to-face when it's possible. And I don't think that that's a huge surprise. And there's the key points there why, and this came from all services, about relationship building, about the lack of privacy for a lot of service users at home. You haven't got the space, you can't, you know, you might have family members around where you can't quite say exactly what you want to say. The other thing, and this again, this is from both the service user and the staff perspective, we're saying about the people's behaviour, appearance, body language, particularly when you're on the phone, but even people who were using the virtual, the screens, were still saying it's a little bit more difficult. A lot of service users and some staff actually were saying that you know, it can be quite anxiety provoking, not being in in a format that you've not really done before. So if it's on here now, you know, we're all on screen. If it's on a telephone, it's just not quite what we're used to. A key one here, which we're keeping our fingers crossed for this week, that it's not going to let us down, is IT and connectivity issues. You know, we're hugely dependent on that at the moment. And then there's other things around, you know, there are people who are maybe hearing impaired, who've got communication difficulties, which this poses a real problem too. Services who are not using video, we're saying actually we think that might be better, because then you can address some of those points I've just talked about. However, it was interesting that those using video did have mixed feelings. I've talked about the follow-up appointments, but I think one of the key things that came through was, and how we can learn from this. You know, we've been thrown into it at this point, but actually, as we get moved forward and we start shaping our appointments in the future, the majority of service users and staff would like the option to offer choice. And it might be, you know, different people, as we know, work differently. And this has been great for some people, not for others. But how can we work towards offering this as a choice, and giving service users more of a choice in the future? So communication, when I did this, I thought, oh, one positive. I'm sure there are lots more positives, but this was just the summary in terms of where we can look at. So service users welcomed contact, interventions, and I just put in there in terms of this really came across specifically in STEP and in recovery. But in terms, again, of opportunities to learn, it's about communication always comes up, doesn't it? And how can we make sure that we are keeping our service users informed of the changes? It may not be what we want to do, but how can we, as in the changes may not be what we want to do, but how can we make sure that people are informed? And the main thing people are asking for is just clear, frequent and reliable communication about the changes. Most people are being very understanding in terms of the comments. You know, a lot of this is out of our control, but also better communication between services. And examples were given between sort of community bases and maybe our inpatient areas, or maybe at the teaching hospital could be better. And also staff were requesting around improved communication between our different tiers, if you like. So the exec team, the board maybe, and teams, and also more collaborative working between teams and the managers. Again, you know, this kind of links onto there, just some, we were thrown into this, as I've mentioned before, but a little bit more guidance staff were asking for, sort of in terms of feeling a little bit unclear as to what their roles are maybe, and what they're supposed to be doing, and what they're supposed to be offering, and what we can and can't do. More contact and communication with carers. Actually, we do focus a lot on service users, but particularly in our early intervention service and in older adults, there was the request or recognition really around more contact and communication with our carers. Accessibility. So in terms of positives, the third theme here, consistencies in workers was really valued. Again, I don't think many of these things are really a surprise, but obviously you've built relationships, so it does make it that little bit easier to if you can access the person that you've been working with. And a couple of examples here that older adults have set up for accessibility to improve that at the current time. And they've set up a telephone helpline to offer support and contact, and also monthly newsletters and information on support and activities, which is really positive. So areas to learn around accessibility. So being able to contact teams by phone, and I'm not sure that this is just because of COVID. I think this has probably increased it even more. But in recovery and SPA particularly, there's long queues, people feeling that they're not called back in a timely fashion. So that's definitely an area that I think has already been focused on, but this highlights that even more. More proactive contact for service users who perhaps live alone, perhaps where there isn't necessarily appointment in there, but just a little bit of a check-in. That's what people were asking for. In terms of pharmacy, offering drop-ins or appointments, but offering a choice of that, comes back to choice again. And then in terms of the teams, we're asking for, you know, better equipment for video conferencing. So actually, perhaps we don't always need to be travelling around to be having face-to-face meetings, but we haven't really got the equipment at the moment for us as members of staff to be able to hold effective video conferencing in meeting rooms. So two more themes: service user and carer support and support for staff. So in terms of support groups for our service users and carers, some were continuing. and I've put some examples up there, but the majority have had to stop due to social distancing. And obviously service users are saying they're experiencing isolation, feelings of isolation and decline in mental health due to the restrictions. The majority are wanting more peer support, and I don't think, again, that comes as any surprise. So we were asking really, what are some ideas? And again, there was the recognition that this is not just for service users, but for carers as well. So some ideas there around virtual groups for people. Again, people preference Zoom because that seems to be a familiar one, about how we can actually set that up and support service users, carers with that. Could some socially outdoor distance groups be set up? Since this questionnaire went out, obviously now there is the rule of 6, but that's not to say that we can't have that. With 6, one-to-one support meetings, online courses, which I know some places are doing, and there was a suggestion around introduction of hobby groups. But just being able to improve the awareness and promotion, if we're setting these up, how do people access them? And then in terms of staff, there were some positives around people feeling supported with supervision, with workplace wellbeing and peer support, and also some changes around collaborative working. And I think in some areas, this opportunity really has kind of strengthened those collaborative working, the partnership between different colleagues. But again, there's always opportunities to learn. And one thing I think that did come out quite clearly was around this is really tough on everybody at the moment. And staff are really working hard to support service users, to support carers. And whilst on a practical level, staff are feeling supported, perhaps around kind of the emotional impact that's having on them, perhaps could have a little bit more support there. So finally, just the final couple of themes, working from home. In here, I've mentioned about the reduction in travel, more flexibility. Some people have said about better Wi-Fi at home, feeling safer, obviously, and for some, less distractions. However, as I've mentioned, IT capability, some staff feel quite judged working from home because not everybody can do that. There's the less distinction. So again, it goes back to, how can we improve personal well-being as well? Make sure that that's not suffering. And again, most people did like the flexibility, and it comes back to choice again in the future. Just some general comments, really. There was an overwhelming gratitude from all of the surveys that came back. Was, we've asked for comments, for constructive comments, but overwhelming gratitude that people want to say, the service users, about, the amazing work that the staff are doing and the commitment that the teams are putting in. And that was really clear. And I think that's really important to share that. And again, the opportunities to learn, great, because people are saying we want to learn from other teams, share best practice and be open to new ways of working. So real whistle stop there in terms of what we're going to do next from a QI team is complete the analysis for all of those 22, go back to teams to present this in the format that I was saying, the quite detailed format, and work with the teams to develop their local improvement plans. Re-engage with teams who have not yet got involved with this, offer it if they would like to, and then triangulate further with the findings from stakeholders. There are links here on our website as well for all of these. I'm just looking at the time, and I'm just, for the last 5 minutes before we open it up to conversation, I'm going to invite Robin Fletcher from Sheffield Flourish, who's going to talk about the work there from Sheffield Flourish that they've been doing. Obviously, like I say, there are some links on here for looking at these reports. They are on our website, so please do look at those. But Robin, I'm going to hand over to you. Before I just do, Ailish, is there anything, I obviously can't see what's going on in the chat or with hands up or anything. Is there anything that you need to feed back to me, Ailish, before I just hand over to Robin, and then we'll open up for conversation at the end?
No, I've seen nothing.
Great, thanks, Ailish. Okay, so Robin, I'm just going to welcome you if you'd like to come in here.
Thank you, Jo. Hi, everyone. My name's Robin and I work for Sheffield Flourish and Sheffield Health and Social Care NHS Trust. Me and Jo thought it would just be a good idea for me to give a bit of a verbal update in terms of a survey that was conducted by Sheffield Flourish around COVID-19 and its effects on our mental health. So I wasn't involved in the survey myself, but I'm more than happy to share the findings because we do a lot of partnership work, sharing important findings across Sheffield Flourish and the Trust. But I'll just explain and introduce Sheffield Flourish first for those who don't know. So Sheffield Flourish is a mental health charity, and it actually grew out of the trust in 2012 under the name Recovery Enterprises, and it works as a blended model, so both digitally and within the community. So digitally, for example, we have different websites. So we've got Sheffield Flourish website where people share their mental health stories. I think there's over 250 stories on there. And we also run the Sheffield Mental Health Guide, which is a directory where you can search for support services in Sheffield. And there's also a similar one, but it's more tailored towards suicide, called Sheffield Suicide Support. And I'll pop the links in there on the comments so people have the links. We also run, so that was the digital side of things. Then the community side of things, we run enterprises, which are regular groups, which some of them have now started to open up with regulations, obviously. And they're run within the community and open to everyone in the mental health friendly. So there's like a football group, there's an art group, a gardening group. I think there's around 7 now. And again, I'll pop a link to those so people can see. There were 2 surveys that we conducted, and the first one was in May 2020, and it was conducted an anonymous survey asking how people were coping in lockdown and whether the COVID-19 pandemic had any negative or difficult impacts on people's mental health or well-being. So that one in May, there were 66 responses, and they were all anonymous and completed responses. There were 4 kind of main points that stuck out, and it's provided us with an increased kind of awareness of the difficulties that people have been facing during the beginning of the pandemic anyway. So the first one was that over 60% of people reported that their mental health had got worse, and then the second one was kind of despite the fact that the majority of people in that survey said their mental health had got worse, people weren't responding that they had sought any mental health support. And then as expected, the mental health difficulties of those who were socially isolating appears to be the most significant kind of factor. And then the last point was that fears about the future were also heavily referred to throughout that survey. And then the second one, because obviously a lot's changed since then, was ran in August. So that one was May, the first one, and this one was August. And again, there were 4 kind of main themes that came back from that. So the first one was that this time over 85% of people reported that their mental health had got worse, which was up by over 20%, about 25% since the last survey. And thankfully, though, it does seem that the people who responded to that survey anyway were saying that they were getting mental health support. So that had increased since the one that was conducted in May. And then the majority of people also in this one said that the lifting of the lockdown had actually directly contributed to the worsening of their mental health. And get back to normal, and worries about the threat of the virus. They were worried about the threats of the virus not being taken seriously. So they were the main findings from that one as well. So yes, they're the findings from the surveys. I'll pop the links in now to all the websites and the surveys again, just so that they're in the comment box if people want to access them. And I think it's back to you now, Jo, is it?
Great, thanks so much, Robin. Really interested in there. Yeah, thank you. So yeah, what I'd like to just really hopefully we've timed that okay, actually. What I'd like to spend the last part of this session on is a little bit of discussion, really, in terms of reflecting on what you've heard. You know, are there any surprises, or you know, are they kind of what we were thinking? But then in terms of sort of suggestions and how can we learn from this? Because actually it's great that, you know, we've got all of this information. What we need to be really clear about is how can we use this? Yes, absolutely, we'll take this back to teams and for teams to do. But this is an opportunity, I think, for the people on this call, and I will take the slides down so that I can see who's on the call. But it is an opportunity then for us to have some conversation around actually how is this going to help us improve? How is this this going to help us improve, the health and well-being? How's it going to help us improve the services that we are providing in terms of from the staff perspective and from the service user perspective as well? So I'm going to just take this slide down now and open up if you want to use the hands up function or in the chat. There is the our email address at the bottom there, qiteam@shsc.nhs.uk. If anybody has got things that they'd like to say but they don't actually want to say it in this forum, that's absolutely fine. So I'll take this down. Thank you for listening, and it's opportunity now for people to put their hands up and have a bit of a conversation. This is always the bit where it's who's going to be first. Has anybody got any thoughts in terms, Terry?
Yeah, hi Joe. It's for those that don't know me, I'm an emergency planning manager for the trust, and this has actually been really interesting for me because at some point when we get back to whatever normal is going to be, then obviously my job is going to be in incorporating all the learning from this as to how we plan for things in the future. And just from the first phase of the pandemic, one of the things that that struck me very quickly was that we've got business continuity plans for every aspect of our trust, but they're all short term, so that everything's designed for what happens if something breaks down for a day or a couple of days or a week. We haven't got anything, and to be fair, no other trust and probably no other organisation had anything in place for something that's going to go on for months and months and months. And so part of the learning for me is that is how we plan for something that's going to go on for some period of time, as is this one. And the other thing I would say, as far, which isn't a defence, is that the pandemic, of course, is being run by central government. It's not, and NHS England, NHS Improvement. It's not a trust thing. We have to comply with as best we can with and interpret what's been sent to us. And my job in the incident room here is to process the information that we get and cascade it and try and make sense of it. And since March, we've probably had well over 500 separate pieces of guidance that have come out from NHS England and NHS Improvement, which we've then had to try to put in place. Some of which is contradictory, and as I say, it's not a defence, but it hopefully demonstrates some of the issues that we have in the centre in trying to send out the right messages for teams as to what you can and can't do and how we can work better with the new guidance that's come out.
Okay, thank you, Terry. John, I think your hand was up next, I think.
Hi, thanks. Yeah, really interesting what Terry's saying there, and kind of to follow on from some of those things actually. There's obviously some great data here, some great information, and I think we need to make sure that it's, well, obviously it needs to be at team level for teams to understand, but I think we need to learn at an organizational level as well. So I was thinking exactly the same thing that Terry said there about, you know, how the organization best advises teams going forwards. It is, you know, that's obviously going to be impacted by the information that comes out of this, isn't it? What the best advice is, and you know, things like, for example, when we make changes or planned changes, we're supposed to do quality impact assessments. This is some really good information to feed into that, so that's in the heads of the people doing those quality impact assessments of, we need to be thinking about these kind of things as well. I know, for example, we've been forced into making some changes that well, we could really have done with this sort of learning beforehand, and we might have asked different questions. So I think, you know, it's how we incorporate it at that wider level as well is going to be really, really useful, really important.
Great, thanks, John. If I keep turning around, I'm making notes as people are saying things. So thank you, Kate.
Hi, just a bit of feedback really. I mean, I know there's been a lot of conversations had. There's been questionnaires, data, lots of conversations, etc. In terms of action, you know, this has been going on for quite some time. I just want to give a feedback really with regards to a group in Sheffield called Kickback Recovery. That's a peer-led support group, and as soon as lockdown happened, they went straight onto Zoom, doing 4 online meetings a week where they were supporting friends and family that are affected by drug and alcohol use. They were supporting the people themselves that have drug and alcohol issues. It's been tremendously successful. They've had a lot of interest, and I know some people within the trust were very sort of like, wow, you've gone ahead and done it, you're far ahead of where we're at. And actually, you know, this has been happening since February, and I'm just wondering, there's a lot of time and effort going into having conversations and sending out feedback, which all takes a lot of time to collate and to evaluate. What do you think's been some of the reasons as to why people haven't just bit the bullet and gone online? I know not everybody has access to technology, etc. But I think in hindsight, just going on in, you know, offering those online groups from day one really would have been really good, just so that people are staying connected. Thanks.
Thanks, Kate. I think that's, yeah, and I don't know if anybody is on the call who can respond to that, or who would like to respond to that in any way. I am, you know, in terms of, it's a very good question, Kate, and I'm not going to pretend that you know the answer. So I've written that down. Lee, and then Carla.
Yeah, I think that's a really good point, Kate. I mean, I work in quality improvement, and yeah, I always think that we don't respond quick enough sometimes, and I think sometimes that's the nature of the NHS to a certain degree, and almost a nervousness about especially moving things online. My reflection on this time is, if we'd have said prior to the pandemic that we were going to switch all consultations online, it probably would have taken the NHS a number of years to do that. So in that respect, I think services responded quite quickly. From my experience working with a number of teams, I think the moving individual consultations and discussions online, teams felt much more comfortable doing that. The teams that I found took a bit longer and had to work through a number of like logistics and some of their anxieties and governance were when it was in a group forum and holding those sessions online. So yeah, I think it's a really important point that if we'd have done it sooner, people would have been helped sooner. But I think from a staff perspective, it took the time it took because it took people's time to get their head round how they'd actually do it in a safe way for everybody.
Okay, thanks, Lee. Carla did have a hand up, but that's gone down. So maybe, I think.
Yes. I put my hand down just because you'd already.
Oh right, yeah, go for it then, Carla.
Yeah. So just to echo those thoughts really. So I've just joined the trust actually. I came from a trust that moved quite quickly to online working. So I'm a clinical psychologist working with older people. So at the start there was a little bit of thought around how we're going to help our clients move to online, bearing in mind most of our client group struggled with technology, but we managed to move quite quickly. And yeah, just wanting to echo, I think it's really important to give the option of online. I think one of the things that I noticed in my previous trust from my colleagues is also a little bit of fear about what that would be like for them to work online with clients. And quite often it was working with staff to think, you know, this is going to be quite helpful, thinking about the safety. So working with them from that perspective, just to allay some of their fears and that sort of thing. And then that helped us sort of move forward but also as a psychologist, I'm also really keen on research. So I think this is also really important, thinking about the evaluation. But I do think sometimes in the NHS we do spend a lot of time thinking and reflecting. And I think sometimes, like the organisation that was mentioned, just doing something can also be quite helpful. But also just want to say thanks so much for the talk and presenting the findings as well.
Thanks, Carla. Yeah, I think that is. I think there's lots of things with the NHS as well, isn't there? I'm thinking from kind of perspective of restriction with our IT, etc. But yeah, I'm conscious we've just got a few minutes left. So I've got somebody's hand up. It just says, I'm really sorry. It just says you on here. But Maggie, is that you?
I think it might be me.
Yeah.
I just wanted to say in response to Kate's comment about what they've done in kickback recovery, that's really, really impressive. And maybe services, I'm just thinking it's something I think our services maybe get caught up in the fact that of what we traditionally offer, an assessment and then a series of therapy sessions and some online group work, but maybe an open group for absolutely everybody on our books, even if it's once a month. Maybe that could be something that we really need to be sort of thinking about, some open accessibility to include everybody, because some people are unfortunately on waiting lists, waiting for their specific one-to-one therapy. Maybe there does need to be some more reaching out. So I, think that Kate's point was very interesting, and I will now lower my hand.
Thank you. Thanks, Maggie. Oh, it's actually just gone back up again. Yeah, thank you. And it's great, all of these comments. It is, I'm collating them all together, and then it's where we kind of take all of these. So yes, thank you. So we've just got a couple of minutes left. I think there's just Lee with his hand left up. So Lee.
Yeah, I'm just going to come back on in terms of the responsiveness, because I think working in quality improvement, I'm actually quite hopeful that teams will learn from this experience. And because going into this, saying that we're going to switch everything online, there was a massive amount of anxiety within the teams I was working with. But a lot of those anxieties didn't materialize, and it actually was okay. And I'm hoping from a quality improvement perspective, going forward, we've almost proved to ourselves that we can respond to something quite quickly, quite challenging. And actually, it almost gives us that reinforcement that we can do things quite a bit differently, and it's okay to do that.
Okay, thanks, Lee. So we're just about at time, which is great. We said we were going to finish it. Oh, sorry, is there another hand up? Sorry.
No, they couldn't put the hand up. There's a question. Mark Guest would like to speak.
Oh, great. Thank you, Ailish. Mark.
Oh, hi. Thanks for taking my call. Sorry, I couldn't put my hand up. I'm using my phone and it just won't let me.
Apologies. Welcome.
Yeah, thanks. Just quickly, I'm with the Stronger Together group at the EIS, and we were involved in production of this survey. Ailish sent that out to us for our comments, and obviously we commented and fed back. Our link member there was Tim. So thanks for involving us as service users to be involved in producing the survey. I just wanted to pick up on a few things, particularly what Kate was saying, that the Stronger Together group had to stop. Obviously, it's a peer group for EIS service users. Stopped in the pandemic, but we wanted to get it going again, and we found that staff were really struggling to use the virtual software, and I think that was a real barrier, and as Kate was saying, the sense that things were quite slow in getting going, that could have helped service users much quicker. And certainly our group, we wanted to continue and get going, but we kept hitting barriers because staff were telling us we couldn't use Zoom for confidentiality reasons, and that they didn't really have the knowledge or the infrastructure to use Teams, Microsoft Teams. And it took quite a long time. And, you know, we were really pushing at that door to try and get that going. And, you know, the service users really were the ones that got it going. And so I think, you know, there's lessons to be learned there. Obviously staff didn't feel confident enough or knowledgeable enough around the software. The problems at EIS at Limbrick using technology in terms of the quality of the internet and the Wi-Fi. So yeah, you know, I think things would have there was a demand, you know, for service users. But I do feel the trust were very slow at responding and getting up and running with you know, with the technology.
Yeah, thanks, Mark. I think absolutely right. I think that came across in the evaluation work that I've just been talking about as well, from both the service user and the staff perspective, and absolutely your experience as well. So thank you to everybody. I'm going to call it a close now. So we just said we're going to finish now at 10:15. If you have got any more comments or questions, etc., you can either use the comments section here, or, as I say, if you want to email the QI team, and you can do with any question. I hope that this has been a helpful session. I hope you signed up for more sessions throughout the week. There's lots going on this week, and just to say a big thank you to everybody for joining, and hopefully we'll see you again throughout the week. Thank you very much.